Have you ever stopped to think about what's really in the pills you take every day? Most of us don't. We trust the medications prescribed by our doctors are safe. But what if some of the most commonly used drugs could actually harm our brains? Research shows that several widely used medications might increase the risk of dementia. And these aren't obscure drugs, they're medications millions of people rely on daily for conditions like allergies, depressions, and heartburn. The idea that everyday medicines could contribute to dementia is unsettling. It challenges the assumption that approved drugs are entirely safe. The truth is, our bodies are incredibly complex and even beneficial medications can have unexpected side effects, especially with long-term use. In this video, we'll explore a fascinating topic: 7 common medications linked to dementia. Are these drugs really causing cognitive decline or is it just a myth? What does the science say? And stick around to find out if any medications you take could be on this list. Before we get started, don't forget to like this video, subscribe to the channel, and share it with your loved ones. Let us know in the comments what medications you take daily and where you're from. We'd love to hear from you. Right now, over 55 million people worldwide are living with dementia, and more than 60% of them reside in low and middle income countries. Each year, nearly 10 million new cases are diagnosed. Dementia can result from various diseases and brain injuries, with Alzheimer's being the leading cause, responsible for 60 to 70% of cases. This condition affects thinking, memory, mood, and the ability to perform daily activities, making life significantly more challenging. Interestingly, certain medications can also raise the risk of developing dementia. Among these, antichlorogenic drugs are some of the most concerning. These medications block acetylcholine, a neurotransmitter essential for memory and learning. They're used to treat conditions like overreactive bladder, Parkinson's disease, and allergies. Common examples include diphenhydramine or Benadryl, oxybutynin, ditrophan, paroxetine or Paxil, and amitriptyline or Elavil. Research has shown a strong link between regular use of antichlorogenics and an increased risk of dementia. For instance, taking a potent antichlorogenic daily for 3 years can raise the risk of about 50%. That's a significant impact from medications many people assume to be harmless. Let's delve deeper into what this means and how to stay informed about the risks. Number 2. Proton pump inhibitors or PPIs. Proton pump inhibitors are another common drug class linked to dementia. Medications like omeprazole or Frezolec and isoframazole or Nexium are widely used to manage heartburn and acid reflux by reducing stomach acid production. While the connection between PPIs and dementia isn't as strong as antichlorogenics, several large studies have shown an association. For example, one study involving over 70,000 participants found that regular PPI users had a 44% higher risk of dementia compared to non-users. The exact reason for this link is unclear, but it might be related to vitamin B12 deficiency, as PPIs can interfere with B12 absorption, a critical nutrient for brain health. Another theory is that PPIs may increase the production of beta-amyloid, a protein that forms plaque in the brains of Alzheimer's patients. Number 3. Benzodiazepines. Benzodiazepines such as alprazolam or Xanax and diazepam or Valium are anti-anxiety medications that are highly effective for short-term anxiety relief. However, long-term use is linked to higher risk of dementia. Research has shown that using benzodiazepines for more than 36 months increases the risk of Alzheimer's disease by 32%. Alarmingly, those using them for over 6 months face an 84% increased risk. These drugs are known to impair memory and cognitive function even in the short term, and prolonged use might lead to lasting changes in the brain. Number 4. Corticosteroids. Corticosteroids such as prednisone are powerful anti-inflammatory drugs used to treat conditions like asthma, arthritis, and severe allergies. These medications are distinct from anabolic steroids used for muscle building. While effective, corticosteroids come with significant side effects, including potential cognitive problems. Research from leading University Medical Center in the Netherlands found that corticosteroids can cause structural and volume changes in the brain's white and gray matter. Another study published in the International Journal of Medical Sciences revealed that using corticosteroids for more than 90 days significantly increases the risk of dementia across all ages and genders. Each of these medications has important medical uses, but understanding the risk is crucial, particularly for long-term users. With over 55 million people affected by dementia globally, understanding potential risk factors is crucial, especially when it comes to medication we use daily. Some widely prescribed drugs have been linked to cognitive decline, particularly with long-term or high-dose use. Let's take a closer at 7 common medications associated with an increased dementia risk and what you can do to protect your brain health. Number 5. Antidepressants. Some antidepressants, particularly tricyclic antidepressants, have been associated with a higher dementia risk. These medications such as amitriptyline, dosifene, and imipramine alter neurotransmitter levels in the brain which may contribute to cognitive effects. It's important to note that depression itself is a risk factor for dementia, so the link may be partly due to the underlying condition rather than medication. However, this association is worth considering, especially for those on long-term use antidepressant therapy. Number 6. Antihistamines. Older antihistamines such as diphenhydramine or Benadryl are another class of drugs linked to dementia risk due to their antichlorogenic properties. Occasional use such as for allergies is likely harmless. However, long-term or frequent use of these medications might increase risk. The good news is that newer antihistamines like loratadine or claritine and cetirizine or Z-Trek don't appear to carry the same risk, making them safer options for long-term use. Number 7. Opioids. Opioids, commonly used to treat pain, have also been associated with an increased risk of cognitive decline. A study in South Korea found that opioid users had a 15% higher risk of developing dementia and Alzheimer's disease compared to non-users. While the exact link isn't fully understood, long-term use for chronic pains seems to pose greater risk, particularly in older adults. What does this mean for you? The goal isn't to alarm you or discourage nearly medications, but to promote thoughtful use and open discussions with your healthcare provider. Here are some actionable tips. Avoid necessary medications. Over-the-counter drugs like antihistamines or PPI should only be used when genuinely needed. Use the lowest effective dose. If medication is required, work with your doctor to find the smallest dose that works for you. Explore alternatives. For some conditions, non-drug treatments like cognitive behavioral therapy may be effective and carry fewer risks. Monitor antichlorogenic burden. Many medications contribute to antichlorogenic activity, which can add up over time. Online tools can help calculate your cumulative risks. Review medications regularly. As we age, our body processes drugs differently. Regular reviews with your doctor ensure you're on the best treatment plan for your needs. And lastly, avoid abrupt discontinuation. Never stop medication suddenly without consulting your doctor. It can be dangerous. Beyond medication, your lifestyle plays a key role in maintaining brain health. Regular exercise, a healthy diet, staying socially active, and engaging in mentally stimulating activities are all proven ways to reduce your risk of cognitive decline. The human brain is incredibly complex, and our understanding of how medications affect continues to evolve. While these findings highlight important risks, they also underscore the need for safer drugs and better informed choices. By staying aware, asking the right questions, and taking proactive steps, you can be better protect your brain health as you age. If you found this video helpful, give it a like and share it. It could help someone else safeguarding their memory. Don't forget to subscribe for more health tips, and let's keep the conversation going in the comments. Together, we can take steps to better brain health.